This video is on the metacarpophalangeal joint and rheumatoid arthritis by Erica Anderson and Lisa Matichik.
Here is the second metacarpophalangeal joint. Above, we have the proximal phalanx 2. Below is the metacarpal 2. Surrounding the joint is the joint capsule. And within is the synovial membrane, which is in orange. Within the membrane is the synovial fluid. In blue is the articular cartilage. The flexor muscle is the lumbrical, which attaches to the proximal phalanx 2 via the lumbrical tendon. The adductor muscle is the palmar interossei, which attaches to the bone via the palmar interossei tendon. The abductor muscle is the dorsal interossei, which attaches to the bone via the dorsal interossei tendon. Here on the human model, you can better see the hand muscles, the lumbricals in both the dorsal and palmar interossei.
Here on the human model, you can see the joint abbreviated MCP with the associated flexor tendons, which are the lumbrical tendons. This is an X-ray of the anterior surface of the left hand with healthy joints.
The structure of the metacarpophalangeal joint is condylar, which means it functions with biaxial movement. The joint can flex and extend. The prime mover of flexion is the lumbricals, and the prime mover of extension is the extensor digitorum. It can also abduct and adduct. The prime mover of abduction is dorsal interossei, and the primary mover of adduction is the palmar interossei.
Here you can see biaxial movement in the human hand. It can flex and extend on one plane, and it can abduct and adduct along the other plane.
It is difficult to see the metacarpophalangeal joint in the cat, so we can demonstrate the biaxial movement looking at the wrist.
Here you can see extension and flexion. Here you can see abduction and adduction.
The second lumbrical is innervated by the median nerve, which we can see here on the cat. Here is a model of the metacarpophalangeal joint with the homeostatic imbalanced rheumatoid arthritis. In this model, you can see that the synovial membrane in red is thickened and inflamed. Also, the synovial fluid is reduced. Over time, the articular or hyaline cartilage, which is in blue, will deteriorate. At the end stage of rheumatoid arthritis, the joint ossifies, causing pain and discomfort when moving. Rheumatoid arthritis is easy to identify due to disfigurement.
This X-ray shows a significant disfigurement from rheumatoid arthritis, which makes it difficult to flex, extend, abduct, and adduct. Although there is no cure for rheumatoid arthritis, there are numerous medications available to help ease the symptoms. These medications reduce the inflammation and slow the progression of the disease. The main goal of treatment is not to cure the disease, but to get to the state of remission.